Hi, everybody. Welcome to DC News Now's What's Going Around segment. I'm Chris Flanagan. So each week we talk to experts and doctors and health officials all throughout the DMV to talk about what they're seeing and what's going around. And this week I'm really excited. We have just a great guest, our friend coming back to join us, Dr. Anna Anzola from the Hearing Doctors, an audiologist here in the DMV. Dr. Anzola, great to see you.
Great to see you, Chris. Thank you.
Yeah, you bet. Thanks for joining us. I'm really excited to have you today, and there's a lot to talk about. But I want to get first, right off the bat, the CDC recently released a report saying older Americans are increasingly dying from unintentional falls, and a lot of it is related to hearing loss or hearing impairment. Why is that?
Sure, great question. And this is such a great topic to talk about because it's not just really affecting older Americans, but it's really affecting anybody who may have a hearing aid related issue. It could be linked to cognitive disorders or impairments and vestibular disorders or dysfunctions.
What do you make of the findings? Do they surprise you? Is this something that you see in your practice daily?
Yeah, and we take a different approach when it comes to hearing health. We tend to look at all three. We can't just say, how did you hear? It's really how the brain works. And the way that the brain really works is that it's taking the peripheral input from the vision center, the inner ear, and of course, in the inner ear, you have the two systems. They live in the same house, so to speak. You have the balance center, and then you have the auditory center. So our hearing centers, and they're both driving information to the brain. And of course, we have it from the sensation from our feet, our muscles, our joints. So all of this, it's kind of like our sixth sense, your proprioceptive mechanism. And they're taking all that information, and then they're making a decision as to, you're in a steady ground or dynamic ground, and how to navigate around it. And so there's a lot more about hearing that goes into play. So you can't just say, I need a hearing test. For us, it's important to look at all three. It's our ABC: audition, balance, and cognition.
And Dr. Anzola, how often are you seeing this in your practice, the impact?
Yeah, I mean, so this is really preventive medicine, in my opinion, where we see patients that may come in with tinnitus symptoms, for example, and we think of maybe you have hearing loss, or maybe there is something going on in the outer or the middle ear. But then we further explore the ramification of how the vestibular system comes into play, and of course the cognition. So there's a lot of information out there that relates um, decreased hearing with fall risk. And we want to look at all the different aspects of hearing health, and then be able to then put in place strategies to manage every single one of them very differently. But we need to explore who's the culprit here. And we see patients falling, and really what we want to do is prevent these falls from even happening in the first place. It's very costly to America and Americans to deal with the ramifications of a fall, hospitalization, rehabilitation, and then just the medical, issues that come into play.
Right. And Dr. Anzola, also JAMA, the Journal of JAMA, released a study as well saying dementia is also being affected by hearing loss, much more so than previously thought. Why is that, and what are you finding?
Yeah, great question. Because we really don't hear with our ears. Our ears is just a mechanism to deliver the signal to the brain, and if the brain doesn't have proper equipment, if limited information goes up to the brain only has so much equipment to do the job to process that information. Our ears just detect the sound. Our brain, so it's more about brain health, really, and then because that's where we process information and we make out what people are saying. And by the way, our hearing is the only organ that we have that keeps us in good connection with the people and the things that we love to do.
Right. Yeah, of course. And what are some of the common signs of hearing loss? And what types of hearing loss? What do you look for when somebody comes in?
Sure. Oftentimes, our patients come in with tinnitus disorders, which is like ringing in the ears. Or maybe sometimes they're coming in with, maybe I'm not hearing as well as I used to, or the family is really saying to us, they're not doing as well as they used to. And so it's important for us to take a look at, okay, how's your hearing? And do a functional assessment as to how they may be performing. Because one thing is hearing, which is detecting the signal, but a different aspect of hearing is how is your brain processing that information, just as important. And of course, if there's diminished information going to the brain, it could lead to early onset of cognitive decline, which is what we're trying to prevent and have a diagnosis much earlier in life. So if you're turning 50, one of the things that you should do is get your hearing checked.
Yeah, great advice there. Many of us who are now in our 50s, we grew up, going to loud concerts, out cutting the lawn, loud machinery. How does that affect years later our hearing?
Right? So implementing hearing protection, we can start as early as the teenager, but it's preventing things. In fact, 30% of hearing loss can be preventable as long as you're implementing proper hearing protection from the get-go. Just know that at 85 decibels, you're putting your ears at risk, and those little hair cells in our cochlea can be susceptible to permanent damage. So you want to do that and enjoy the activities that you like to enjoy, going out to concerts and loud sports, or participating in loud sports, or even loud machineries, or going out to the gun, or the fire range. Um, this is important to implement hearing protection. If you're going to be around that, just put on some great hearing protection. The best gift you can give yourself.
That is great, great advice there. Is hearing loss permanent or can it be reversed with any sort of treatment?
Yeah, so it really depends which part of the ear. Is it the outer ear, the middle ear? Typically, those two are more conditions that can be reversible or treated with medical intervention. So, audiologists, we do more of the assessment and we find out what part of the ear is compromised. Is it the outer, middle, or then the inner ears? But 95% of the patients that we typically treat with hearing aids or amplification systems have more of an inner ear disorder.
And Dr. Anzola, will hearing loss get progressively worse over time?
So, unfortunately, yes. Typically, if it's inner ear disorders, it's permanent, it's degenerative, it will continue to decline. And so that's why early intervention is very critical to the outcomes. So, identify it as soon as you have some symptoms, as soon as you know, and you want to have that conversation with yourself, that honest conversation, am I really doing well, while watching television with others? Am I asking for repetition? Am I having difficulties in group settings or loud restaurants? So these are signs, and you should get it checked out. And the earlier you intervene with, say, amplification system, if that's in order, then absolutely you have the best outcomes, and you are minimizing cognitive decline.
And Dr. Anzola, typically, do both ears um, have the hearing loss equally, or do you see, one ear is worse than another? How does that typically work?
Sure, great question. Also, that typically is what we like to see, that both ears tend to decline, because if it's age-related issues, it's not going to compromise one more than the other. And really being exposed to loud levels of noise is not going to pick one over the other, unless um, you were exposed, say, to some sort of trauma in one side, or a car accident, and then maybe you had some sort of head trauma on one side. You may have a hearing loss in one ear versus the other. But let's say you've had that for a long time and you kind of went by and got by for a long time. That's actually very dangerous to us, because something else, maybe an underlying medical condition that might have been overlooked. It's not
And
normal.
Yeah, no, definitely. Dr. Enzo, let's talk a little bit about hearing aids. The technology has changed, I imagine, so much in the last few years. How often should you get your hearing tested? And you had mentioned at 50 years old. And also your hearing aids. How often should you replace them and get those tested?
So if amplification's in order and hearing aids are in order, and they're really fantastic today. I mean, I am so impressed. They're very small and invisible, and they're very smart. We now use artificial intelligence, and they're no longer big and clunky, or they used to call it the beige thing or the pink thing in my ear. They're not. They're really invisible. They work really. They're life changing, but they're assessing the environment and making changes on their own based on the typical environments that you're going in and out of. They have directional microphones. They're Bluetooth. They're able to be connected to your phone, so you're streaming directly to the ears. They're fantastic, and so typically a hearing aid, I would say most people replace it every 3 to 5 years, something like that. You should get your hearing checked every year, and a hearing test is covered by insurance, so really there's no downside. And if you are needing more in depth, which is what I recommend, a really in depth um, auditory and vestibular assessment. So we're actually looking at both centers. You don't want to take one out of the equation. It's no longer about a hearing test. Is how's my balance? How's my cognition? And how's my audition? All of these things is what, for example, here at Hearing Doctors is what makes us very special. We take that comprehensive approach with our patients and dissect the ear because it is kind of like a little puzzle, and we find out who's who's in need of what, and then make proper recommendations. And that's part of what we do on a daily basis. Because again, we want to prevent people from falling. We want to mitigate people having early cognitive decline, and definitely treating that loss so I can stabilize it for a very long time. It will continue. Your auditory system will continue to age, but if I can delay or prolong any changes, that's the best thing you can do for yourself.
Dr. Anzola, there is a stigma with people wearing hearing aids. How much of a factor is that when somebody comes in and, maybe they're on the fence and they're concerned about having hearing aids? I know the technology has changed, they're much smaller now, but I imagine you see patients coming in, that there is a stigma.
Yeah, I mean, they're not like glasses, right? These are sexy, these are cool. Uh, Actually, in my opinion, hearing is sexy because if you're able to manage to have a great conversation and not miss out, or be left to, aside of the conversation, that's really troublesome for a lot of people. They tend to withdraw. So we want to prevent our patients in our communities to not have that outcome, to really take a more proactive approach to better hearing health and live active and healthy lives. That's what it's all about. So wanting to do something earlier on in life, um, it's the best approach that you can take. So to me, getting a hearing test is the first thing that you can ever do. Go into a place that is reputable, that has all the equipment and state of the art technology that can get you there, and really just working with great audiologists
Mhm.
um, that can give you the proper advice as to what's needed. And again, to me, a hearing loss is more noticeable than the actual hearing aid.
And I know there are many different types of hearing aids. There's in the ear hearing aids and also ones that fit behind the ear. What are the differences, and why would you, recommend one for one person, not another? And how do they work?
Sure. Again, depending on the advice that you're getting, it's all about what product may be great. So there's about 9 different products out there, and just working with someone who can recommend and advise you. Some of them may be recommended for certain type of ears. Um, we say that the ear is the boss. It really dictates what fits in there. Looking at the configuration of the hearing loss, looking at what we might be best for that type of ear in that environment. Hearing aids do live in a very toxic environment. We don't think of our ears being toxic, but they are. There's a lot of wax in there. There's humidity, and so working with a great audiologist that can guide you as to what is the best product out there. But many of them today are very invisible, even the ones that are over the ear. The ones that are like in the ear, they may be more visible, but there's the ones that go deep down in the ear cavity. Those are the invisible solution. And I think those are made by, I think once upon a time they were more geared towards the baby boomers, but
Mhm.
everybody wants to hear.
Absolutely. What other options are there available other than a hearing aid?
Sure.
Is there an option?
Absolutely. So there are bone conductor type of, hearing aids out there, depending on your hearing loss. There's a cochlear implant. So when hearing aids, when a hearing aid is no longer a good viable solution for this particular client or patient, and then there's something more stronger. So it's an implant.
So how did the cochlear implant, how does that work for on a patient?
So it's surgical implanted, and it just, has a processor and it just hangs right over the ear.
And are there any other surgeries that could help improve hearing aid
Hearing aid or the hearing
or
loss.
hearing loss, I should say?
Sure.
Yeah.
Yeah, yeah. So again, depending on the damage, is the damage to the outer ear? Is the damage to the middle ear? And so let's say one of the tympanic membrane or the eardrum or one of the bones or the ossicles are no longer working. So there intervention, medical intervention that can replace them and make that a very good system and be able to recoup some of that hearing loss. But about 95% of the hearing losses that we treat are more inner ear related. Unfortunately, that's permanent damage to the cochlea. It is progressive. Um, it will continue to decline and degrade, unfortunately. But with the
Mhm.
hearing aid, we can treat for the delta, the difference between where they may be, where they should be, and be able to stabilize it there for a while before it changes again, because our system will continue to age and decline and degrade.
And Dr. Anzola, what about a cost? I know a lot of people, no matter what it is, they worry about how much it's going to cost. Are many of the devices or procedures, are they covered by insurance?
Some of them are, and if you're lucky enough to have coverage, absolutely take full advantage of that. You're right, but to me, it's an investment, right? Um, so would I rather just have my hearing continue to decline and degrade, or would I want to then have the best hearing health for the rest of my life? So it's a personal decision. You can also opt to there are different levels of technology. So you can start off with a lower tier versus the upper tier, just really depending on what type of environments you might be exposed to. With hearing technology, you don't want to maybe overdo it, but just do it right. Have those conversations with your audiologist or your hearing healthcare provider and talk about, okay, I'm in this situations. My goals are to address X, Y, and Z, and then make that medical decision. After all, it is a medical decision, but there are also other ways to finance them. So,
Mhm.
so looking at the overall well-being and investing in my hearing is truly life-changing, and that's what people say. I can't believe I didn't do this earlier.
Right.
Oh my God, I didn't know it was going to be life-changing. Thank you so much. It's the best gift I've ever given myself. I mean, there's so many great things and outcomes. I know
Yeah.
that there's a price out there, but to me, there's no price to hearing. It's really investing in the quality of hearing, and then keeping my independence. We
Hmm.
talk about that a lot as we have an aging population, and one of the things that they don't want to lose is their independence. So keep yourself as active as possible, intervene with amplification as soon as possible, and really just trying to mitigate any fall risks.
Dr. Anzola, I've got to ask on a personal level, what's it like when you hear that, when you hear a patient say, oh my gosh, I can hear, or I can hear clearly for the first time in years or perhaps decades? Uh, what is that like? What is that moment like?
It happens to us every day, right? And it's very dear to us. And I know most audiologists have gone into this profession because we really wanted to make a big impact in our, in our patients, in family members. Their family members is just as important. It doesn't just affect them; it really affects the whole family and friends and their communities. So it really is a lot of crying, you know, because it's really life changing for them, and that's why we even joined the profession, and we want this profession to continue on with the best instrumentation that we can possibly, ever offer our patients to maintain, really maintain healthy and active lifestyles for the rest of their lives. It's important.
Dr. Anzola, I want to ask you about swimmer's ear. We're just wrapping up the summer, of course. Many of us spending time in the pools or the ocean. We all get swimmer's ear, right? And you always hear these old wives' tales of hopping on one foot and you know trying to get the water out. Is there any way to get cured from swimmer's ear?
Yeah, sure. So there's swim plugs that you can promote, whether you're a little kiddo or somebody who may be exposed to, bacteria in different type of waters. It's not always, clean water, something you may be exposed to. So there is protection from water as well. So implementation of those, we do this a hearing doctor. So this is something important that you should have a conversation with your audiologist or hearing healthcare provider.
And Dr. Anzola, another question. This impacts all of us when we clean out our ears. We get a Q-tip.
Yeah.
I guess we shouldn't be doing that then, right?
Yeah, I mean, if so, we have wax in our ears, and that's what we need to lubricate the area to keep it in good health. But when we're going in there with something that's pushing the wax, all you're doing is impacting. And so perhaps creating a wall of wax that should not be there. And then we have to then take it out, or you have to go into a medical office to get the wax removed. So no, you're stimulating the glands that produce wax, so don't do that. You're pushing the wax in. So we don't recommend that at all. Q-tips were just really meant for the outer part of the ear and perhaps more on babies because it's so hard to get in there. So no Q-tips.
All right, no Q. That is good advice. Good to know. Well, I'll make sure I tell my family don't do that anymore.
Yeah.
Let's talk quickly about tinnitus. I know we talked about it quickly. You mentioned it off the top. What exactly is it, and how does it affect us every day?
Sure. I mean, I personally suffer from tinnitus. So it's a symptom. It's a symptom that one part of the three ears might be damaged. So the outer, the middle, or the inner ear. And so most of the times people come in with those symptoms. But again, if it's outer or the middle ear, it could be, intervention, medical intervention that could, uh, cure that or satisfy that need, and it typically goes away. So, because if you had a lot of wax in your ear, you may have tinnitus. If something happened to the middle ear, or perhaps you have an ear infection, so that would be that could lead to tinnitus symptoms. But also, if you have inner ear issues or decreased hearing, you may come in with tinnitus symptoms. It could happen in one ear, it could happen in both ears. Um, Sometimes it may be louder in one ear if there's more degradation of hearing in that one side. So there is a correlation between, hearing loss and tinnitus. The great news is to know there is no cure. I would have cured my own tinnitus a long time ago, but hearing devices can actually do both. It can address the tinnitus symptoms and augment the differential. So give you the proper correction that you need in order for you to hear well and clearly, and at the same time tend to mask the tinnitus.
And Dr. Anzola, what causes the ringing in the ears that many of us get? Some of us live with it, others get it periodically.
Sure. If you have been, for example, exposed to very loud levels of noise, it could be a temporary shift or presence of tinnitus, letting you know that was too loud. Don't do that again. And definitely wear hearing protection if you're going to be exposed at any venue over 85 decibels. If the tinnitus is related to perhaps the hearing loss, perhaps say in the high frequencies, that's a very common hearing loss that we tend to see and address. It may be due to that high frequency, the difference where you don't have good hearing. So that's typically where it occurs. Again, is working with an audiologist that could give you a good management treatment and trying to figure out, okay, is this due to something that can be masked with hearing aids, or there are other treatment options out there?
And can tinnitus lead to something much more serious down the road?
But we don't know. Like, tinnitus, if it's not related to any of those things, we looked at, what's happening. Did you have maybe dental work or TMJ disorders or anything else? It could absolutely be due to more serious underlying medical condition, but that's why we start with the hearing test to analyze which part of the ear may be the culprit of this tinnitus symptom, and then go from there. We may refer you to an ENT or uh, otolaryngologist, and then be able to then determine, okay, what may be happening. So
Mhm.
an MRI or a CAT scan may be in order to find out what else is going on.
And Dr. Anzola, finally, why do a lot of people you hear, um, I guess no pun intended there, but you hear people say it's ring more so at night when they go to sleep as opposed to during the day?
Surely. So at night, typically your world is very quiet. During the day, the world has been sort of masking your own noises or tinnitus. So it's the masking effect. Now, for example, with hearing devices, we can learn to habituate to present something else more interesting to the brain, and so the brain is not constantly being annoyed, because it's a brutal cycle. You hear it, you get annoyed, you hear it louder, you hear it more. There's really nothing that you can do, and people tend to lose hope with that. But there are different mechanisms out there by which we can try to lessen that annoyance, but it is a lot more evident or louder in the absence of other sounds that are not masking your current tinnitus.
Dr. Anzola, this has been just a fantastic talk, nice conversation. Really appreciate you taking time and lending your expertise. It was really just so impactful. I appreciate it.
Absolutely, my pleasure. Anytime.
Yeah, you bet. All right, Dr. Ann Anzola from the Hearing Doctors here in the DMV. Dr. Anzola, great seeing you. Thanks again.
Absolutely, my pleasure. Take care.